Evening, everyone. Just a reminder that we are also live broadcasting this event, so we are hoping to start on time. So if it would be great if everybody can come in and settle in. I'm starting. Good evening, everyone, and welcome to our inaugural policy dialogue, Mahamari or Auraton ki Aapbeeti, Women, Ordeal, and Opportunity through Pandemic. This evening, we look forward to an engaging conversation with the speakers, panelists, and the audience on the topic at hand. Before I invite Vinay Nagaraju to give his welcome address, I would request the panelists and speakers of the evening if they could join me on stage. Just a second. The name slides, yeah. Thank you. I now invite Mr. Vinay Nagaraju, Executive Director of Inclusion Economics India Center, to give his welcome address.
Good evening, everyone. My warm welcome to you to this inaugural policy dialogue of Inclusion Economics India Center. We are a policy-engaged research initiative housed at IFMR, the Institute for Financial Management and Research, with strategic oversight from Krea University. We work closely with inclusion economics at Yale University and researchers from several leading international universities to conduct data-driven research on economic and social inclusion. Our body of research and policy work was previously known as EPOD India. Our vision is a world where research and dialogue ensure economic justice, social opportunity, and environmental protection. The work in India includes several research engagements across multiple states and focuses on some of the country's most challenging problems, ranging from pollution and climate change to women's economic engagement to supporting effective governance and building state capacity. Today's policy dialogue is our earnest endeavor to inform public narratives and share data-driven insights while also learning from others. We regularly interact with policy counterparts and researchers from a wide variety of disciplines and share our findings with the public both here in India and internationally. As we emerge out of the pandemic, our societies and governments are navigating not just unfamiliar waters, but in many ways uncharted waters. We continue to share an anguish for the enormous economic misery this pandemic has caused to the marginalized people. The images of migrant workers walking long distances to return to their rural homes soon after the first lockdown, especially those images of women carrying children and walking endlessly in the scorching sun, will continue to haunt this generation for a very, very long time. Even a few steps far removed from these heart-rending stories, it is clear that the pandemic has dismantled known ways of public policy making and challenged us to think creatively to address these seemingly intractable problems. Our topic for this evening, Women, Ordeal and Opportunity Through the Pandemic, underscores the pressing issues around women and offers an opportunity to discuss and debate solutions. As UN Women rightly said, this pandemic underscores society's reliance on women both at the front line and at home, while simultaneously exposing structural inequalities across every sphere, from health to the economy, security to social protection. In times of crisis, when resources are strained and institutional capacity is limited, women and girls face disproportionate impacts with far-reaching consequences. Hard-fought gains for women's rights are also under threat. Responding to the pandemic is not just about rectifying long-standing inequalities, but also about building a resilient world in the interest of everyone, with women at the center of recovery. Professor Amartya Sen, in his essay titled Sunlight and Other Fears, and in discussing the importance of school education, says, and I quote, "Empirical work in recent years has brought out very clearly how the respect and regard for women's well-being are strongly influenced by such variables as women's ability to earn an independent income, to find employment outside the home, to have ownership rights, and to have literacy and be educated participants in decisions within and outside the family. Indeed, even the survival disadvantage of women compared to men in developing countries seems to down sharply and may even be eliminated as progress is made in advancing the agency role of women." Unquote. Students of history and economics will remember the times of World War II in the United Kingdom, when stereotypes about women's capacity and ability to engage in quote-unquote men's work were circulated by the employers and the government. During World War II, women worked in factories producing munitions, building ships, aeroplanes, in the auxiliary services, and as conductors and nurses when men were in the battlefield. The entry of women into occupations which were regarded as highly skilled and as male preserves, for example, as drivers of fire engines, trains and trams, and in engineering, metal and shipbuilding industries, renewed debates about equal pay. Today's state of the world is, in contrast, far more complex and requires carefully thought through solutions informed by data and evidence. The immediate solutions are perhaps as complex and urgent as crafting longer-term solutions. Who better to lead our pathway to this dialogue than Dr. Rohini Pande, Henry J. Heinz Professor of Economics and Director, Economic Growth Center at Yale University. She is a co-editor of American Economic Review's Insights. Pande's research is largely focused on how formal and informal institutions shape power relationships and patterns of economic and political advantage in society, particularly in developing countries. She is interested in the role of public policy in providing the poor and disadvantaged political and economic power, and how the notions of economic justice and human rights can help justify and enable such change. Before joining Yale, Dr. Pande was a professor of international political economy at the Harvard Kennedy School, where she co-founded Evidence for Policy Design. I now request Professor Rohini Pande to give her introductory remarks. You can introduce Charity.
Thank you very much, Vinay, for those opening remarks. And let me start by thanking everyone here, including especially those from Krea and IFMR LEAD who've been hosting our work for many years, and the Inclusion Economics India Center, both staff and leadership who have provided us a great forum for this. So I think I'm going to really just jump straight into what I hope is going to be the meat of the program today, which is to describe to you what we've been seeing in the data on many different fronts as we've looked at women's labor force participation both before and during and after the pandemic. And just to stage set a bit, I'm going to start by just very broadly talking about trends that we've seen at the broadest level, And then I'm going to hand it over to Dr. Charity Moore, who co-leads inclusion economics at Yale with me and was really influential in starting a lot of the work. And then I will leave it to Charity to introduce the next speaker after her. So can we have the slides up? So while the slides are coming up, as I said, I'm going to start by really talking about, what was the discourse on women's work in India just prior to the pandemic, and then how do we see what has happened during the pandemic. I think Vinay has already given some sense of one of the big questions at this point is the pandemic going to necessarily make things worse for women, or like other economic shocks that we've seen at different points through history? Is this a moment where we can perhaps think about change, and what would that take in terms of policy and otherwise? So I think this is a graph that at this point, all of you have seen at different points in many research papers and in media outlets, that the period starting around just after the 2000s, there was a striking decline in female labor force participation, largely driven by a drop in rural female labor force participation. So urban labor force participation was low but relatively constant, while female labor force participation fell from an average of around 1 in 3 women working to basically roughly 1 in 5 women working. And this was true at the point when we entered the pandemic. Many people have talked about the reasons for this. Many of the panelists here have done extremely important work on this. What I want to do is to really step back and look at some of the recent data from the Periodic Labor Force Survey to just highlight what were some of the markers of women's labor force participation that we saw over this period. So I think the first fact that doesn't often get enough recognition in discussions is what is striking about the Indian case is a lack of entry rather than exit. So typically, the way women's labor force participation decisions are often described is to say, well, everyone enters the labor force, and then when women have children, childcare concerns, for instance, causes them to take time off, and whether or not they come back really depends on how good the economy is at ensuring that they can use the talent and provide support. And this gives rise to a description of women's labor force looking M-shaped, and then in some places maybe it's a little bit more L-shaped, that women drop out and don't come back. I think the Indian case looks very different. You can see that men typically pretty much all enter, that's the blue line. They enter a bit later than other countries. People have given that as an example, for instance, that they're taking government entrance exams and so on, but it reaches close to 100% by the age of 28, remains stably at that level till early 50s, and then people start retiring. And this is data from 2017 all the way till 2020. This is the PLFS every year. In contrast for women, and this is not a pattern that's changed over time, women just enter at a lower rate. They increase monotonically till the mid-30s, and then they slowly start dropping out. But what you're not seeing is, say, a 22-year-old looking the same rate of entry as a 22-year-old man, and you're equally not seeing this M shape where a lot of women are dropping out at the time of having children. And I think, this is not to take away from the importance of many policy endeavors that we need in areas like childcare, but I think the big issue in India that we have to think about is how are we dealing with this window of opportunity, especially in an increasingly more educated female population. And the second thing that you also see in the data is you don't see having children as being a strong predictor of dropping out of the labor force. So what this is looking at is the IHDS data, which is panel data. So it follows the same women at 2 points in time in 2005 and 2012. And then it asked, did these women have a child between 2005 and 2012? And what you can see is that the blue line and the red line look, they have slightly different patterns, but you're not seeing some dramatically large change or decline in it. So it's, may have some predictive power, but it's not a very strong predictor. And again, looks very different from other countries. What is, however, true is that there's a large difference in female labor force participation by marital status, so what we would call selection. Women who remain unmarried participate at much higher rates through their lifetime. Women who get married at some point are just much less likely to participate at all points in their life cycle. And then the last fact, which I think is well known, that even if we control for income, we see reasonably large differences in participation rates among different social groups. And lower caste and tribal women, especially tribal women, participate at much higher rates. So the difference between participation can almost double depending on which group you look at. In earlier work, we had looked at older NSS data, and we saw that in each group there was also a desire to enter the labor force if you didn't. So it's not the case that this is reflecting fully preferences. There are tribal women who are not working who want to enter the labor force, as much as there are Muslim women and upper caste women who are not working who want to enter the labor force. These are a set of facts of what was happening to the Indian labor force prior to the pandemic. So let me now just turn briefly to a couple of facts we know about the pandemic and then hand it to Charity, who will build this out in more detail. So we're going to look, as you know, and there's a very healthy debate on what is the right data set to look at patterns of what's happening with Indian women. One of the frequent data sets that has been used quite a lot is the CMIE one which gives average monthly employment. What this data set shows that female employment in 2021 is 6.4% lower than in 2019, while for men, there is a decline, but much smaller. So women have lost a lot more ground, according to CMIE data. Importantly, what we see, and this is something I think Farzana is going to speak to, unlike earlier, where largely the declines were coming in rural areas, we now see the largest declines happening in urban areas. So average female employment in urban India was 22.1% lower in 2021 relative to 2019. This is not true in rural area, and in fact, there are recent reports that employment among rural women may even have gone up. So we are seeing at least the medium-term effects of the pandemic are playing out a lot more in urban areas than rural areas. Another data set, PLFS, actually suggests, if anything, that female labor force participation has risen in rural areas. And some of this is definitional differences. CMIE asks, did you work yesterday? PLFS asks over a longer time period. And so anything that asks about a longer time period is going to pick up sporadic work more often. But certainly what you see even in the PLFS is that fewer women are seeking jobs in 2021 compared to 2019. I think this is across the board to some extent. Even among men, you're seeing fewer men are looking for jobs. So just to show you what this is saying the change in the fraction looking for jobs by different categories. And you can see that among female rural and female urban, we see significant declines in the likelihood that you're looking at a job today. You report looking for a job today relative to 2019. That is not true for men. Men are looking for more jobs. And finally, let me end by just noting the fact that this experience was not unique to India. We see this from WDI data across the world, that there are declines in labor force participation. But what I think is striking about South Asia, and of course India is a large contributor to it, is the orange bar, which is females' labor force participation declines, are just so much larger than we are seeing in other parts of the world. And with that slightly pessimistic note, I'm going to turn to Charity, who's going to give us cause for optimism. So as I said, please welcome Charity Moore.
Thank you, Rohini, and I hope I can be a bit more optimistic about things. The situation, 2.5 years into the pandemic, we know women have really been hurt in many ways due to the pandemic, but I guess I get to talk about the good news, so I will dive into that. And the first is we have, a few lessons that are really relevant to understanding women's economic activity through the pandemic, but also maybe ways that can help shape that economic activity moving ahead as well. So the first thing I wanted to point out is that safety net investments can protect women's access to work during an economic downturn. I think many of us, if not all of us, know the fact that when COVID hit, Narega was really a core feature of India's COVID response, right? So many people were moving back to rural areas, migrating quite quickly. And what this figure shows you is India's total household demand for work under Narega, which is, for those who may not know, we are live streaming this, so maybe some people are less familiar with the Indian context. Narega is a public works program in rural areas, so if an individual would like to take on work near their home, they can go to a local leader and request some form of low-skilled labor or work and then be paid for the work that they've done. So demand is actually a request for work under the program. And what this figure shows you is it's comparing the demand for Narega work by Indian households in the year of the pandemic, 2020, and then in the 3 years prior to the pandemic, 2016 through 2019. And what we see overall is that demand for work under the program increased by 45% compared to those earlier years during that first year of the pandemic. Now, for those of us who care a lot about women's access to work, it was actually a little bit concerning when we knew, it was a good thing that people were able to access work, as there was a lot of economic distress right after the first nationwide lockdown. But lots of us had concerns that, lots of male migrants have returned to rural areas. Narega has been a very important employer of women for a long time, low-skilled women in rural areas. And so as men are coming back to these rural areas, is it possible that these women are going to get pushed out of the program as, kind of the ability to meet this demand for work is actually capped? And it appears that, that may have happened in some cases, but if you look at Narega statistics, actually female person days worked has, it dropped just a bit during the pandemic year, but it's there's no sort of precipitous decline in women's work days under Narega, which is great. And then some very important research that Farzana Afridi, who's sitting here and will be speaking after me, has done with some colleagues, shows that in locations that were able to historically deliver Narega at relatively high levels, Narega itself was actually able to protect rural women's employment and even increase it in some cases after the initial nationwide lockdown. I'm sure she can comment on that more. But really the point is, a lot of times people talk about it's so important to invest in social assistance and safety nets because they're counter-cyclical, and then, they can flexibly scale up when we have major shocks to the system. Well, those investments may actually be, gender-intentional investments, whether we realize it or not. And so that was actually an excellent move that India had invested in Narega as a social safety net prior to the pandemic, of course. The second lesson that I think we can work from or learn from as well is that government can actually employ women while advancing their own policy goals. And this goes back to this issue that, private sector work opportunities are really limited in many rural areas. And in a survey that I conducted with Simone and Rohini and others in this room and maybe listening, in late 2020, we interviewed mukhyas across rural Bihar in 11 districts. And we asked them at that point in time, tell us what your top priorities are. And the number one issue that these mukhyas mentioned, probably unsurprisingly for those of us who know the context well, 59% of them said that the lack of economic opportunities was what weighed on them the most. Issues related to COVID at that point in time, where managing quarantine centers was obviously very important at 55%, but the spread of COVID was a much smaller concern for them than the economic consequences of the pandemic and what was happening, right? So we know that since the pandemic has begun, there's been in some ways, a dry up of private sector labor opportunities. And, research has shown us that employing local women can actually improve service delivery and help government achieve their own goals. So a recent interesting paper that's come out shows that just employing an additional half-time worker in, the preschool system, the ICDS system, increased children's math and language scores, and then actually even reduced severe malnutrition and stunting in Tamil Nadu. So this is exciting in the sense that there are many women in rural areas who are not working. There are huge service delivery issues in rural areas, and simply adding a part-time worker into this program was actually very instrumental in furthering the state's goals and was quite cost-effective in doing so as well. The last piece of evidence I want to show you related to kind of government work and government being an employer of women in particular is through this figure right here. And this is PLFS data from 2019 through 2020. And what it looks at is it asks all people who report doing any sort of work, and I've broken it by males and females and rural and urban areas, and it asks who is your employer. And what you see is that about 10% of men, those are in the blue bars, sorry to be so stereotypical, I didn't choose that on purpose, but about 10% of men in both rural and urban areas report being a government worker of some sort. It might be their primary job or their secondary job, but they're working for the government. Slightly higher percentage of urban women report working for the government, but the statistic here shows that nearly 30%, nearly 3 in 10 women in rural areas who actually have a job are reporting that they're working for the government. And actually a lot of this is comprised of NREGA workers, and Rohini was pointing out to me that these women who work under NREGA are very proud of the fact that they have what they would consider a government job. It is a job from the government. But beyond the NREGA work, there's also kind of this core group of women that increasingly are employed through initiatives like NRLM and the many different ways in which they're employing women as sakis of different sorts and CRPs and MBKs, and there's a whole litany of abbreviations that we can run off that are all just different types of employees or women who are employed in rural areas. And of course we know, Anganwadi and ASHA workers are very important employees in their community. The last lesson that I think we can learn from, or insight I think we can learn from, is that policy itself can directly shape women's economic outcomes. And it can even shape some of the restrictive gender norms that really do drive whether women are in the labor force in the first place. And this is pulling from a study with Erica Field, Rohini, Natalia, who's here, Simone, and then myself. And the setting that we worked in, where this insight comes from, is in northern Madhya Pradesh. And I think one of the main things that's salient in this context is just how gender inequitable it actually is. So this setting has very poor sex ratios, ranging from 0.84 to 0.9, and there are large age gaps between husbands and wives and education gaps. And just to give you a sense of the context too, the average woman in the sample has like 1 year of education. So these women have very low levels of education, and we first began working with them about 10 years ago, and they were about in their late 30s at that point in time. So we worked in surveys across 4 districts and did an intervention across 4 districts. And what we found is that only 28% of women that were in our control areas of a randomized control trial stated that they had any say in whether they could go outside the home to work for pay. So there was very much restrictions on their mobility and on their decisions about what they could actually do in terms of earning a living. And something that was really striking, but not surprising, I think consistent with a lot of data that we see from around the world, is that men tended to be more conservative about women than women about the idea that women should be able to leave the home and go out for work. And the other thing that was important here is that men really, in this setting, perceive a very strong social stigma on them when their wives work. There's a perception that if my wife works outside of the home, then I'm sending a signal to my whole community that I'm a poor provider. And so this reflects poorly on me, and my community may even, speak poorly of me or, think badly of me because my wife is working outside the home. So there are very strong kind of ingrained cultural views about why it's not appropriate for women to leave the home, and a lot of it kind of goes back to men and how it reflects on them. And in fact, when we asked men in this sample, if there are 10 community members, how many of them would think badly of a husband whose wife goes out for work, and they would think he's a bad provider, on average about 5.6, or the men would say about 5.6 community members would think poorly of them. So 56% of community members would think poorly of them. So what did we do in this setting with such deeply entrenched, kind of very conservative and restrictive gender norms? Really, we did something that was quite simple. All we did was implement NREGA in the way that the government had laid out in its direct benefit transfer policy, with the aim and the intention to empower women. And it was really simple. In 2014, we worked through a randomized control trial where we opened bank accounts for women, and then we linked these individual bank accounts to women's NREGA wages that would be coming into those bank accounts. And then because the women really lacked an understanding of how to even go, bank at a local kiosk, which is what you see in this photo here, we actually trained women how to actually access those accounts and be able to withdraw their own money. Now, this was like a very simple thing, right? I mean, essentially what we were saying is, let's implement the government's DBT policy. And the reason it was important that we were doing it was because the status quo was something quite different. The status quo was that rather than receiving one's individual wages into one's own bank account after having worked, for this program, instead the wages were going straight into the bank account of the household head. So if I went out and worked on a road project or something for 1 or 2 weeks, when the wages came into our household, they would go straight to my husband, and he could decide what to do with the money. So it really took away a lot of the power that I might have in terms of deciding what I wanted to do with these wages, how to invest our money, and so on. So what we found just giving you the brief version, is that women who received this direct deposit and training intervention ultimately both won and then later on, 3 years later, worked more for the Narega program. But not just for Narega, they also went outside the home and started taking on casual agricultural opportunities in the private sector. And they did this above and beyond what women who kind of received bank accounts did. And our impacts were strongest among women who had actually never worked for Narega in the past. And the way that we explain this is that, these women who hadn't worked for Narega before, and if we look at them, they're what we would call kind of socially constrained women. They had husbands who were, more regressive in terms of their views. They had less autonomy overall and so on. So, what happened kind of in layman's terms is that, when you shifted the balance of power in the household by saying a woman's wage would, instead of going into the household head's bank account, it would go into the woman's bank account, we changed that balance of power, and women were able, who wanted to leave the house and go out for work, were able to negotiate, leave the home, go out and work, and this changed their lives in important ways. But beyond just changing their labor force participation, one thing that was really exciting about this study was that when we went back to these women 3 years later, the ones that had opened the bank accounts and received training and received their wages or potential wages into these bank accounts, they had more liberal views on whether it was appropriate for women to work outside the home or not. And their perceptions, too, of community norms and community views related to whether it was appropriate for women to work had actually become less restrictive as well. And that's what this figure shows you here. The women that had this more intense intervention, which was essentially, a very simple government policy, became more accepting of women's work and then thought their community was more accepting as well. So that's exciting. It shows us that simply implementing a policy that recognizes that women are individuals and should be paid wages into their own bank accounts, it actually does empower women in many ways and was important for these women and could even shape some of the norms around that were kind of keeping them from being able to exercise agency in the first place. But I think, one important question is what happened to these women since the pandemic began? So let me just show you a few things that we do know from both administrative data and survey data. The first is I'm showing you here a figure that compares women that were in this most intensive direct benefit transfer and training treatment arm in the navy blue, comparing them to women who only received bank accounts or opened bank accounts in their own name. And what we see is that, several years later, actually I think it was like 7 years after this intervention began, these women who were signed up for direct benefit transfer and had been trained were receiving more Narega payments and received more Narega payments through the lockdown. So we see that the investment that was made through this intervention and just implementing this policy appears to have been protective of them through the lockdown. We're currently getting additional data and we'll be looking at what happened to them over the past couple of years as well, because that's a huge question. But we also were so excited to try to understand, did this intervention that was powerful for these women, was it actually protective of them through the pandemic? Unfortunately, I can't tell you the answer to that right now because we're still collecting this data. Right now, we've gone back to all these women. In fact, we have some wonderful staff from Inclusion Economics India who are here and are part of going back to 4,500 households to actually collect this data to understand what's happened to these households since the pandemic began. But what I can do is show you a little bit of preliminary data from the information that we've already collected to give you a sense of what happened to these households through the pandemic. The first thing I want to point out is that we actually had relatively high mortality. And what happened, according to our ongoing survey, I'm showing you here, these are cumulative quarterly deaths by gender and by quarter, both prior to the pandemic. And so the first line shows you when the pandemic began, and the second line shows you when the Delta wave occurred. Essentially what happened in these households is approximately 4% of the males in the households unfortunately passed away since the pandemic began. And if you compare male deaths to the same period prior to the pandemic, only about 2% of them had passed away. So we see this excess mortality, which is clearly coming from COVID itself. So COVID hit these families in a very close way in many cases, in terms of health impacts. And this is perhaps a little bit less surprising in the sense that, we started working with these households 10 years ago when women were in their mid to late 30s and they're now mid to late 40s and their husbands are about 50 years old as well, or in their 50s. So this, everyone's kind of aging, and COVID was, devastating for many of them. And here's a statistic here related to male deaths that we saw. And so alongside, the impacts of COVID and the health impacts, there was widespread use of kind of what we call adverse coping mechanisms, right? So we asked households, since the pandemic began, what have you done? And what we see kind of most frequently among women is that 79% of women in the sample reported that they have eaten less or consumed less. 73% said that they, reduced consumption of essentials, however you would define that. And then 63% of women reported borrowing money to just make ends meet and survive. So a lot of women and a lot of households were clearly undertaking a lot of activities that were draining savings, that were, now they've taken on debt that they have to pay off. Many of them sold off assets and that sort of thing too. Now, within these households, another important question that we had was to better understand what happens to girls through the pandemic. And so what we've seen is we were able, and as I mentioned, we're still collecting data from these women to understand what has school dropout been like since the pandemic began. And so what I want to show you here is the dropout rates from school by gender for both males and females. So here in this case, I've got the blue line is for females, and the salmon line is for the male children. So essentially what we see is that girls begin to drop out of school at a higher rate among this group, approximately at age 15. And by the time we get to age 20, most of the girls have dropped out of school already. I think, the major question is what's the counterfactual here? What was this like before the pandemic? I think we have a little bit of evidence on this that suggests that there was a COVID-specific penalty here, but that's all TBD, and we're in the middle of data collection, so I don't want to go beyond kind of what we have so far. The second thing that's important to note is, marriage was a coping strategy for families. They would allow their daughters to be married quite quickly, and then, this was something that they did to kind of avoid having as they're coping with economic distress. So what we saw is that marriage rates for girls in our sample belonging to the age group of 15 to 18 was 22.5%. So many, many young girls, 1 in 5, were getting married. If you compare that to boys, their marriage rate was only about 6%. And again, this data is still coming in, but there's a lot of early marriage that's still happening within our sample. Again, we don't have a counterfactual to know exactly what this was beforehand, but it clearly is, there's a gender gap in what's happening here. And interestingly enough, when we asked families, going back to this question about schooling, and said, why did your child drop out of school? There are really gender-specific reasons that kids were dropping out of school through the pandemic. The first, and probably unsurprisingly, given the figure I just showed you, was that many girls were reporting getting married, or their households were reporting that they dropped out to get married. So 1 in 5 reported dropping out to get married, and then 1 in 5 also reported that school was too far for them to attend at this point in time, and so they left again. Boys, on the other hand, both boys and girls reported they couldn't afford school, but the other, important reason that boys dropped out is that 40% of them said they were no longer interested in studying. So, it's a real contrast in terms of the reasons that are pulling girls and boys out of school in this setting. Now, there's one other thing I want to just kind of leave you with, and this is hopefully, potentially, a piece of good news, or a potential silver lining, or at least a potential opportunity. And that is, I think many of you know and remember that when the pandemic first began, there were lots of news articles and lots of discussion about, this is not a normal recession. Normal recessions hit men more. The economic downturns that are coming and have happened as a result of the COVID-19 pandemic are gender specific. In fact, people were talking about the she-cession. And in fact, we've seen some of that. But the reason we thought that is because, there were school closures, kids were now at home, and so, there was this potential that people would kind of revert and, reinforce stereotypical gender norms. And in fact, if you look at research around times of lockdown in, say, Europe or the US, that's in fact what happened. When you start asking people about gender norms and who should be taking care of children and doing housework and so on, when you ask people during a lockdown, they tend to reply much more kind of stereotypically, like the woman should be doing all of the housework and taking care of the children. In India, we didn't see that. And in fact, Ashwini Deshpande had this interesting paper that showed that, well, when the lockdown first began in India, men were taking on some more household chores. And of course, after a little while, that stopped. But at least it was a little bit more positive. So a big question has been, has the pandemic really reinforced typical gender norms? And should this be a concern to us? What we're seeing so far, we don't know the answer to that, but I'll show you just a little bit of evidence that shows, at least in this case in northern Madhya Pradesh, which already had very regressive gender norms, doesn't look like the case here at least at this point in time. So what I'm showing you here is a figure, again, going back to this question about, how does my community judge me or judge my husband when I go out of the home to work for pay? And this is the reports from the recent COVID survey of the same sample of households where men, were more likely to respond that they were judged poorly if their wife worked outside of the home for pay. And what we did was we divided the sample here among households that reported relatively low economic impacts of COVID and compared them to households that reported relatively high economic impacts of COVID. And what you see is that these post-pandemic views on gender norms appear to be more liberal and so the bars here are higher, so essentially saying my community is more supportive of women going outside the home to work. Among households that were actually hit hardest by the pandemic. So if we thought that the pandemic made norms much more regressive, we would think that bar there for the high economic impacts would be lower than the blue bars. Now, of course, the big question is, well, the pandemic probably hit people that were poor anyway, and very poor people in India probably hold more liberal views on gender norms because they understand that women should go out for work because the household just really needs some money. But if you actually put this into a regression framework and you're controlling for one's own views that they reported years ago on whether women should go outside the home and work, this result kind of sticks. So it suggests this isn't just a story of this happens to look this way because the people who were the most liberal are the ones that got hit the hardest. But all, preliminary, it's intended to be provocative and really just point out that, we should think through what are the potential opportunities now for women, given that, norms may be malleable and they may be shifting and may have shifted due to the pandemic. So those are the good news, the lessons, probably more than anything. And so I just want to lay out what the goal for the rest of today is. And that really is to build a picture of the specific impact of the pandemic for different groups of women all across India. So we have a number of phenomenal researchers sitting here on the stage. And many of them work with the team at Inclusion Economics India Center who put this wonderful event together. And just to give you a sense of how busy and how effective this team was at actually trying to collect data to understand what was going on, I want to show you this timeline here. And these are surveys that the team conducted in the first 5 months of the pandemic. I'm not going through them or anything, but the point is when the pandemic hit, they were, all hands on deck and essentially went from in-person surveys to phone surveys, surveying migrants returning home from urban areas, surveying government workers to understand how they could be helpful to them, surveying rural women and so on. And so much of that research that came out of those initial days, but also research that's been ongoing for the past 2.5 years, will be featured here tonight and shared from this team. So what do we aim to do through all of this work? Really, we just want to understand how the state, how markets and how society interact with women's economic opportunities and their broader agency. And then, our goal truly is to identify and support opportunities for policy to close some of those persistent gender gaps. So I've finished my remarks and I want to introduce to you all these lovely ladies up front before I turn it over to Farzana next. And each one of them, I'll say, is going to share a specific profile of woman or a specific aspect of life through the pandemic or through these past few years that may be relevant to thinking through women's economic activities and then post-pandemic recovery as well. So our next speaker is Farzana Afridi. She's a professor of economics at the Indian Statistical Institute in Delhi, of course, the lead academic of the International Growth Center's India program, and she's a research fellow at the IZA. She's currently on leave as senior visiting fellow at the National University of Singapore in the economics department. And we're so fortunate that she happens to be in Delhi with us now. Her research lies at the intersection of development and labor economics, specifically gender and social identity, human capital and governance. And you'll potentially note that the rest of the people have been affiliated with the team at Inclusion Economics India Center, so I think the fact that Farzana is here speaks to how highly we regard her work, and would love to have her working with us, yeah. Next, we have Bhavya Sinha. She's a research manager at Inclusion Economics India Center, and she leads the research team on our gender and governance policy research. Prior to Inclusion Economics, she worked as a research associate at JPAL South Asia. Next, we have Natalia Regal. She's an assistant professor at Harvard Business School in the Entrepreneurial Management Unit, so please consult her with all your business-related questions. She has a PhD in economics from MIT, and her research interests include entrepreneurship in low-income countries, the design and targeting of financial products, and how social norms affect women's economic decision-making. And then finally, we will have Simone Shaner. She's an associate professor research of economics at the University of Southern California. So she studies how social and economic environments shape individual and household choices, elucidating how beliefs and power affect the decision-making process. Her work explores economic mechanisms that contribute to inefficiency and misallocation in low-income settings with a focus on labor, financial, and healthcare products. And she has a bunch of affiliations. For those of you who know, the Bureau of the Bureau for Research and Economic Analysis of Development. She's a JPAL affiliate and an affiliate with CIGA, the Center for Effective Global Action, and faculty research fellow at the National Bureau of Economic Research. It's a lot of different affiliations. That's great. So without further ado, I'm going to turn it over to Farzana. She's going to share the first profile through the pandemic, which is focused on low-income women. So without...
Thanks. Thank you so much, Charity, for the introduction, and thank you for the invitation. As Charity pointed out, I'm the only one who hasn't worked with inclusion economics here, so it's a great honor to be here. I'm going to talk about urban women. I think we've heard quite a bit about rural women from Charity and the work that inclusion economics has been doing. So if you can have the slides. Or can I just move them myself? Okay, great. So let me first start with, I think, something that all of us know, but I just wanted to put this in perspective by looking at the CMIE data between 2019 and 2020, just a comparison. And what we see in the first graph here is the sharp decline in the labor force participation rate overall, right? So if we compare 2019 and 2020. But then we also want to look at what was happening in rural India relative to urban India. And on the face of it, it doesn't look like it's very different, but the impact in urban areas in terms of the labor market and the employment shock was slightly higher, more significant than it was in rural areas. And if we just look at the aggregate data itself, then it seems that for women, given that they already had low levels of labor force participation, so the data that we have on the extreme right, which is the C graph, is not conditional on workforce participation. So the decline that we see for women seems to be very small relative to the fall that we see in labor market participation for men. So what I'm going to focus on first is a micro study that we did in urban India. And to be specific, it was amongst poor, primarily informal workers who were residing near industrial clusters across 5 districts of Delhi. And the reason we were focusing on industrial clusters also was because these were, the probability that there would exist demand for their labor would be higher than it would be otherwise, given the proximity with these industrial clusters. And what we did was a random survey of households, approximately about 1,600 households, in which there were husband and wife residing. So this is matched data. So we interviewed both the husband as well as the wife in the 18 to 45 age group. So this is prime working age group. So approximately we would have about 3,000 individuals. And there were 4 rounds of surveys that we conducted. So we were starting off with a randomized controlled trial, which was in 2019. So we had done an in-person survey, both at the household level as well as the individual separately for the husband and the wife, trying to understand their labor market outcomes and work preferences and earnings. And then when we finished our intervention, the COVID lockdown happened. So this was in April, May of 2020. And we were able to get back to these households through a phone survey, but we were able to talk only to men for certain aspects, particularly the employment outcomes. But I'll show you also some of the results that we have for mental well-being, where we were also able to talk to their wives as well. And then, of course, we had subsequent rounds of surveys, which happened after the lockdown was over, which was August and October of 2020, and then finally in April, June of 2021, which was again the second wave of the COVID pandemic, and as we know, which was much more disastrous than the first wave was. So I'm going to walk you through these rounds, and basically this is just to give you an idea of these, these were polling stations that we used in order to sample these households across Delhi. So what you see on the left-hand side is the men's work status, the working status, which defines proportion of men or these husbands who were working. And as we move towards the right, it is subsequent survey rounds. So we have pre-COVID-19, which is darker, and the lighter bar shows during the second wave of the COVID-19 pandemic. So that is 2021. And on the right-hand side, you have the panel showing what the self-reported working status for women was. And we have 3 bars there, as I pointed out. That was because during the lockdown itself in 2020, we did not interview the women personally. And so what you see here is that there was this very sharp decline for men in particular, but also a very sharp recovery for men, which after the lockdown happened. But for women, the decline itself is small, but so is the recovery. When we look at the monthly earnings, then the monthly earnings almost halved for men, whereas for women, the earnings were low to begin with, and then the recovery is also small. Again, the recovery is tapering off as we go into the Delta wave that happened in 2021. And which groups were affected more? It seems that it was the casual labor and self-employed who were worst affected in terms of the decline in earnings that they saw, and also in terms of the extent of recovery that we see in 2021. So just to summarize, the self-reported working status fell by over 85 percentage points during the lockdown and remained lower by 31 percentage points in 2021 relative to pre-crisis. Whereas for women, again, it has remained 8 percentage points lower in 2021 relative to pre-crisis. And we see sharp declines in earnings also compared to the pre-crisis earnings. But let me then now go to the mental well-being. So we ask questions about psychological distress. And we ask questions about particularly in terms of financial stress, in terms of depression, sleep disorders, and so on. And what we see here again is that it is high both for men as well as women. And then it increased during the Delta pandemic. But what you see in terms of levels is the fact that women report greater mental stress compared to men, both in terms of anxiety, nervousness, and other disorders. And this seems to particularly affect those women whose husbands had lost their livelihoods as compared to women whose husbands had not lost their livelihoods. And the fact that wives' continued employment during the pandemic is actually positively correlated with depression amongst unemployed men, which tells us that, again, given the breadwinner norm that men, we have as in our society, it might have created stress for these men, given that they weren't working, but their wives were. And irrespective of this loss of connection that you have with your network when, during the lockdown, because you're not able to connect to people, women, we kind of document the fact that the structure of social networks and social connections that women have is quite different, particularly in an urban context, than those that men have. And there's a very homebound structure that women have. They are very close to their neighbors. They're close to relatives who may not be co-residing with them. And that actually perpetuated the stress causing this contagion, because they were not able to get out of the, the atmosphere and the conditions that affected and the shocks that they were suffering during the pandemic. And so I'm going to end with what Charity mentioned about the NREGA program. in accompanying work, we were looking at what was the effect in rural areas as a result of Narega, which again Rohini pointed out was one of the, the bulwarks of the response that the government had to the pandemic. And what we are showing here is what the increase we saw was in Narega work days on the left panel. And on the right, we see that those districts which historically had been providing a larger number of Narega person days of work, their response to the pandemic was also better in terms of even further increases relative to 2019 in Narega person days. And what we claim in this paper is that if you increase state capacity to provide Narega work, then you're going to see an improvement in the or stemming job losses as a result of the pandemic. And this overall high historical state capacity to provide Narega work cushioned the job losses in rural areas by about 11%, but it was much higher for rural women, and particularly for ever married women. So women who were married relative to women who were never married benefited more from Narega, higher provision of Narega during 2020, and also women who had children at home benefited more. And again, this points to the fact that women have preferences for work which is closer to home, but also the fact that women's work unemployment is counter-cyclical, and these were the women who were going out and supporting their families given the shocks that we saw in the labor market. So the question then is, why did this not happen in an urban context, particularly since the shock of the COVID-19 pandemic was much greater in urban areas than it was in rural areas? And now there is, of course, discussion within the government to provide this social protection even in urban areas, but I think that's what we need to continue pushing on. Thank you.
Hi, good evening, everyone. Slides. Okay, great. So this discussion focuses on women's work during the pandemic, the challenges they faced, and the opportunities present before us for mitigating these challenges, not only in times of crisis, but also in normal times. We draw insights from government-led initiatives that have played a key role in providing work opportunities to women. So some of these initiatives are listed on the slide. First, I'll be talking about findings from our surveys with Anganwadi workers. About 1.4 million workers work as women Anganwadi workers, which points towards a massive scale at which women can be impacted. Thereafter, I will be speaking about social auditors of welfare schemes such as the Narega. The Social Audit Society in Bihar employed over 1,000 women in 2019, with the scope of employing many more women. Lastly, I'll focus on the female banking agents providing last-mile banking services in rural areas. We are evaluating this program with Jivika, the State Rural Livelihoods Mission in Bihar. As you can see, in Bihar, there are over 9,000 customer service points, of which 36% are Jivika-run CSPs. These are all led by SHG-linked women. Okay, so in August 2020, we conducted surveys with women working as Anganwadi workers at the village level. These are community workers providing key health services to pregnant and lactating mothers and children with the objective to improve the nutritional and health status of women, of mothers, as well as children below the age of 6 years. We surveyed over 500 Anganwadis in Chhattisgarh. We also surveyed about 3,600 women in rural Raipur to gauge whether the intended beneficiaries received the services of these Anganwadis. Here's what we learned. About 100% of the Anganwadis provided crucial services during the pandemic. These included take-home rations as well as immunization services and supplies. 1 of 2 Anganwadis expressed concerns about COVID contraction as well as lack of transportation facilities. From the rural surveys with women, we understood that a vast majority of these women actually received these services. So over 80% received the take-home rations in some form, and over 90% received immunization services as well as antenatal care checkups. So where is the opportunity for us? In order to allay some of these concerns that these Anganwadi workers face, I think it's important to equip these Anganwadi workers. From the data, we can see that they have these concerns. So here's what we think. We think that providing PPE kits as well as transportation facilities can allay these concerns. There are other safety measures that we can take, such as providing health insurance to Anganwadi workers. Another area where women have been involved during the pandemic is as auditors of NREGA. The scheme itself serves as a critical safety net that provides employment to the rural poor. Under the scheme, women have played the role of auditors to identify implementation gaps and accountability of the scheme. We carried out an RCT spanning roughly 3,400 village clusters or gram panchayats to study the impact of audits on NREGA program outcomes like work provision and payment to workers. As part of the RCT, we also dive deep to understand audit implementation in Bihar. We did qualitative interviews with the social audit staff, and we monitored asset verification at 24 work sites. Here's what we found from these qualitative surveys. We found that 80% auditors did not have ID cards. There was a high female participation rate of over 60%. These female participants, they expressed the need for training and facilities on the ground. And there were also significant delays in payments, which could lead to attrition in their work as auditors. So what's the opportunity for policymakers here? The policymakers can think about improving capacity building for these auditors, which includes provision of identification cards. We also should focus on areas to provide additional training as well as facilities to these women on the ground. And these facilities should be gender focused because they express these concerns, and oftentimes we are not able to catch these concerns because there are no grievance redressal policies that are defined for these women. Lastly, I'll speak about the banking agents program. So another program where women have been involved during the pandemic is providing last mile banking services in rural Bihar. This was especially crucial during the pandemic when the access to financial services was important for the rural poor in carrying out transactions which included receiving government direct benefits. We're evaluating the program as an RCT in 110 GPs in Begusarai, Bihar. As part of our evaluation, we're trying to understand the changes in the life of a woman as she takes on the role of a banking agent. We're doing this through monthly process monitoring surveys, and we're going to carry this on for over a year. And so far, we've got fairly positive insights in terms of women empowerment. About 40% of these women have reported an increase in their household making decisions, say, which includes the purchase of expensive items, it includes everyday household decision making, and it also includes savings and loan decisions. We've also seen an increase in their perceived respect from men, women, and the community. Interestingly, we find that the respect from women that they receive is the highest at about 90%. However, we do find that about 80% express a need for additional training material. So clearly, the focus here should be on capacity building, which includes providing additional training material and devising effective grievance redressal policies for these women as well. So lastly, I would like to summarize the policy opportunities present before us in all the studies that we've done with women in government-led initiatives. We find that women find work opportunities with the government very desirable. So this is quite evident from a lot of the work that we've done in the field. We also find that women continue to feel empowered in these positions, and they would like to remain in these positions. However, these positions come with some implementation challenges, and the key focus here should be to address these challenges to get these employment opportunities right so that we can continue to empower women. Thank you.
Hi, everyone. Here we go. Great. I'm Natalia Regal. I work as an assistant professor at the Harvard Business School. As Charity mentioned, if anyone needs business advice, I'm happy to guarantee you a negative 100% return on your investment. So come to me if you need that. So what I'm going to do over the next 10 minutes is explore how phone use and phone ownership in Chhattisgarh has affected women's lives through the pandemic. I am going to use data from a large-scale experiment that is wrapping up at the moment, that is conducted with a lot of the people here on the stage. I'm not going to tell you much about the actual experiment that we're running because thanks to our team, which is all in the back there, we have just successfully completed the end line, and we'll start the process of doing the analysis. And so hopefully very soon we'll have causal results from the experiment. Instead, what I'm going to do is talk a little bit about the program on which the experiment is built. And so this is a program that was run by the state of Chhattisgarh in 2018. And what the state did is that it provided nearly 3 million women, mostly in rural areas, mostly poor women, with access to low-cost, locally made smartphones. And so women were given access to a phone that had smartphone capacity, so access to the internet. In addition to the phone, they were given access to 6 months of free internet, and the government also built towers in areas of the state where there was not very good phone reception and internet reception. And so I'll tell you a bit about one of the experiments that we have. Part of what we wanted to understand as a first step was what is the impact, at least in the short run, of giving women access to phones. And so we knew exactly when the program was going to be implemented, this large-scale policy. And what we leverage is the timing of when the implementation happens. So everyone that we survey at baseline is going to receive a phone approximately in September of 2018. But the way that we can estimate the causal impact in the short run of giving women access to phones was that we randomized whether the baseline survey was conducted for women right before they received the phones, and so we see the status quo, or right after. And so that allows us to estimate causally what was the impact of giving women phones in the short run. We also collect long-run data. This is the data collection that is just wrapping up for all of the women in the study. And so we can observe their outcomes both in the short term and in the long run. The sample of women that we work with won't be surprising. They're poor women, mostly uneducated, so 65% of them are literate with 5 years of education, and they're poor. So on average, households are earning about 6,600 rupees per month. I'm going to just do 2 insights that we've seen from the data to make this really simple, and hopefully we'll follow up with the larger paper. The first insight is that providing women access to smartphones liberalizes norms regarding phone use and boosts phone ownership and engagement for women. Okay, so giving women access to phones liberalizes norms and makes them use the phones more. So let me show you a couple of pictures that we think are really striking. So as Charity mentioned, one of the things that we're really interested as a team is in understanding the norms around women's economic behavior. And so in the project that Charity talked about, we were interested in norms around women's work. In this project, we were interested in norms around women's cell phone use or engagement with technology. And so what I'm showing you here is, so you can see that the red bar is what happens pre-distribution. The blue bar is post-distribution, so there's about a 3-month gap between those 2 sets of surveys. And then in the green bar are the long-run results. We asked women to tell us, and also their husbands, we asked them to tell their opinion of whether they thought that married women should have access to a phone without supervision, or with supervision, and the same question about unmarried women. And what we see is that almost immediately after the phones are given, there's a big boost in the liberalization of these norms. So women themselves, much like what we see in Gwalior and MP in our work on employment, we see that there's a liberalization, so people become more accepting of women being owners of smartphone and being able to use that with and without supervision. And what's interesting is that a lot of the boost happens among the questions related to women's use without supervision. And here's a really striking picture, which is that a pattern that we saw when we started this project all across India is that there's a tremendous gender gap, both in ownership of phones and usage. And what we see here, both in the short term and in the long run, is that we flipped it and reversed it. And so when we look at the pattern of smartphone usage here, we see that the gap between men and women's smartphone usage actually reverses. So whereas normally men are much more engaged with phones, now we see in the long run that it's actually the reverse. It's women who are more engaged with phones. We don't see much change along the usage of basic phones. So for the most part, all of that remains the same. All of these results are basically implying that the reason you see this change in usage pattern is because women are more likely to use features like the internet or be engaged with using their cameras or WhatsApp. Okay, so the first big insight is that just giving women access to phones changes the way that they use it and changes their views about how appropriate it is for women to use phones. What I'm going to do next is then show you some correlational evidence to try to motivate why it is that it's so important to give women access to phones. All I've shown you so far is that their behavior changes with regards to the phone. Let me try and motivate by thinking about or looking at data from the pandemic, why that's important. So one thing that we do in the study, and Charity actually mentioned it in the graph, is that we collect high frequency data. So about every 1 to 1.5 months, we survey women. And it happened that we were able to survey them over the phone during the pandemic time. And so we have a lot of data about the experiences that they had. And they were very similar to what the previous speakers have mentioned about the suffering that women had in the pandemic, a lot of loss of income, loss of access to healthcare, and importantly, big shocks in mental health. And so what I want to do now is show you how is it that women who had access to phones experienced the pandemic differently than women who didn't. Okay, and the big punchline is that women with access to phones were better informed about COVID, had better mental health, and had more social connections. Okay, so here what we see is I'm dividing the data by whether a woman had her own phone or she didn't. When it comes to COVID information, we asked women to tell us if they could identify a way in which COVID spreads. So unprompted, we asked, what are the ways in which COVID spreads? And we see that women who own phones are much less likely to not be able to name a single way in which COVID spreads. We also ask women, again unprompted, to tell us what are some prevention mechanisms for COVID, for example, wearing a mask or washing your hands. Again, women who had access to phones were able to name more prevention methods than women who didn't. We also see that there's actually a big difference in the mental health that women had along the time of the pandemic as regards to phone. So here I'm plotting whether a woman owns her own phone or she doesn't, and I'm plotting indicators that have to do with mental health, and these are really the most severe kind of answers to the question, which is, did you see, for example, did you feel nervous, or hopeless or restless most or all of the time in the last 30 days. And again, women who own phones are much less likely to report that they felt any of these symptoms other than depression in the last 30 days. And so mental health was better when women had phones. One mechanism that might explain both of these findings, that they had better information about COVID and that they had better mental health, is that they were more socially connected. And so what we find is that women who had access to phones were more likely to be able to call their friends or call their families. they're also more likely to reach out to Anganwadi workers or health workers. And so that might be a mechanism through which they become better informed about the situation with COVID. And so I'm going to wrap up and just repeat the main 2 points that we have here. So the first is that providing women with smartphones really drastically changes their engagement with the phone, and that's something that persists in the long run. And two, this suggestive evidence that phones are important, and they were especially important during the pandemic in keeping women both safe and with better mental health. And so looking ahead, hopefully soon, you'll see a paper in which we analyze the experiment, and the experiment is meant to increase women's engagement, increase their value to the phone. And so what we'll be hoping to see is how women who are more engaged with phone use, what kinds of outcomes they perceive from the, what kinds of outcomes they have. Thank you.
All right, fantastic, and hopefully that will come up in a minute. I think, Urvi, I'm going for 15 minutes, so I'm really delighted to be here. You know, I think for a number of reasons, it's wonderful to see people that care about these really important issues, you know, kind of in person. I'm very happy to be sharing with them, and I'm especially, you know, both delighted and honored to share them with a number of the really wonderful IAIC staff in the room who made some of these, I think, incredibly valuable and time-sensitive and difficult to implement surveys happen. So, you know, big thanks to all of you, and I'm really happy to be kind of hopefully illustrating, you know, the output of that work and why it matters. So what I want to do is take some time to talk about sort of the labor market trajectories of male and female migrant workers who were displaced in the aftermath of, you know, India's initial nationwide lockdown. This is joint work, again, surprise, surprise, with a number of individuals, you know, kind of in this room, including Rohini and Charity, as well as other co-authors, you know, who couldn't be here. So I don't think I have to motivate this very much for this audience, but, you know, this lockdown was abrupt and tremendously disruptive. You know, most individuals had 4 hours notice that the economy in the country was essentially shutting down. As a result, millions of domestic migrants returned to their home villages. This was the largest internal migration since partition, really bordering on a humanitarian crisis, and a significant labor shock. It is effectively severing employer-employee links between urban areas and resulting in surging labor supply in rural areas. And, you know, this is, I think, very important to emphasize how serious this is in the sense that there's quite a lot of economic research demonstrating that for poor individuals, rural-urban migration is a really important income generation strategy and a pathway out of poverty. And so effectively what was happening here is that for millions of people, that pathway was effectively shut down and they had to return home. And what I want to do is sort of talk about 3 different research questions that we try to address in the study. First is just to understand the extent to which these displaced migrants are able to get back to where they are. Are they reintegrating into urban labor markets, or, you know, if they're staying home, are they able to find meaningful work? The second is understanding what the implications of these labor market trajectories are for the earning and economic well-being of men and women alike, and in particular comparing, you know, kind of the trajectories of men and women. In my view, I think this is a really interesting and important study population in the sense that, you know, rural women who leave their home to go work in distant urban centers are kind of some of India's most intrepid workers. We've had a lot of the panelists talk about how low female labor force participation is. And so, you know, I kind of view these women as the bold and the brave, and there's a question, you know, if they're not making it, what are the challenges and how can we assist them? All right, to tell you a little bit more about the research design and the data, I think this also highlights what in my view is one of the benefits of the type of work that inclusion economics strives to do, which is really forming productive research policy partnerships with individuals in states. And what this meant for us is that when the pandemic happened, we had these ongoing collaborations with stakeholders in both Bihar and Chhattisgarh. And when the pandemic, you know, kind of hit, we sort of said, hey, like, what can we do to help? You know, what are some of the big issues? And as a result of that partnership, we were kind of able to access sort of databases that had a list of the individuals who are kind of return migrants to those areas. And so in terms of the design, we started with this gender-stratified sample of migrants who are listed as returning to Bihar and Chhattisgarh on those official migrant worker rolls. And we enrolled over 4,500 of these individuals into a phone-based panel survey. What you can see kind of on the right-hand side of this slide is just a graph of, kind of the different survey rounds. And effectively what we did is we sort of did round one baseline, which was really focused on economic distress, because that was done in the middle of the lockdown where nobody was really working. And then we sort of have 3 different subsequent follow-up rounds, 2 through 4, which were focused more on migration, employment, and well-being. I'm going to kind of refer to them throughout as recovery phase 1. This is kind of the period just as that first national lockdown is lifting. You can kind of see the red line, by the way, is COVID caseloads in India. We have recovery phase 2 is kind of at the maybe like a good spot right before the Delta wave peaked, where things were perhaps starting to get back to normal. And then we had the final survey round take place after the Delta wave. And I think one of the things that I view as a really important contribution to this survey is that we enrolled this panel and we tracked them, for over a year. There's sort of a lot of media reports on how difficult things were for migrants in the aftermath of the lockdown. And that work is very important, but it's also really important to understand, kind of what happens over the long term, and this is why we follow these people for over a year. And for that reason, I'm going to focus on about 1,800 of these migrants who participated in all of the rounds, so I can tell you exactly kind of how they're moving from place to place and job to job. And I also am going to limit attention to those who were working prior to the pandemic. This was essentially all men, but also 2/3 of women, okay? So these are all kind of workers who were displaced from their jobs. All right, so the first, kind of panel is that, or the first key takeaway I think to point out here is that getting back to urban labor markets is difficult. And so the way to read these graphs is essentially the yellow bars are telling you the share of these workers that reported being outside their home village. Remember, they all came home in the lockdown. The share of workers who are outside their village, kind of in the initial aftermath of the lockdown, there basically everyone's still kind of at home, right? It took some time to try to remigrate during recovery phase 2, right before Delta. At this point for both, women and men, around half of individuals kind of are able to get back to those urban markets, but there's still, kind of over half of individuals and more women are remaining in the village. And, kind of post-Delta, you can see there was a bit of remigration. In that sense, the share that are remaining in the village remains. And, just sort of pay attention to those sort of gray squiggly bars, because that's telling you kind of about the shares of people who are going from one state to another. And so what you can see is that, things are kind of dynamic, especially for women. If you look at recovery phase 2, those who are outside the village, kind of almost half of them go inside the village, but there's also the share that are in village that, migrate outside the village, right? So people are moving around quite a bit. And this graph may, you may look at it and you sort of say, okay, well, like, why is she showing me all this spaghetti? But I actually think there's kind of 2 really, really useful insights to take away from this graph. And so this time I'm switching up what the vertical bars are, okay? So the first bar, that black bar, is unemployment. The light yellow bar is agriculture. The darker yellow bar is unskilled. And the red bar is skilled labor. And I'm just tracking what individuals are doing kind of from sector to sector. So if we look at what's going on, like just the fact that this looks like spaghetti is telling us something really interesting, which is it's not like women are kind of getting home and doing one job or not working and staying constant. What's happening is there's all these different transitions, right? From skilled into unemployment, from unskilled into agriculture. There's quite a lot of moving around. And a second thing to note is that women in particular are really struggling to get back into skilled work, right? That first bar is showing us what's happening pre-pandemic. Most women are not doing skilled work, but it really, really gets small and people are unable to kind of get back. What's happening is we have this large share of women who, kind of especially pre-pandemic, were in unskilled labor. And you can see this sudden expansion of the black and light yellow bars, right? Women are really being absorbed into unemployment in the agricultural sector, particularly in the immediate aftermath of the lockdown. Here's what the picture looks like for men. You see a lot of similar things, right? A tremendous amount of dynamism in the labor market. It's very clear that agriculture and unemployment are absorbing a lot of workers in the immediate aftermath of the lockdown. But one of the more striking patterns for me is if you look at what's happening with skilled employment, right? So first, pre-pandemic, men are much more likely to be in skilled employment. Remember, that's the red bar. There's a huge contraction, right, following kind of the aftermath of the pandemic in recovery phase 1. But men are just much better able to get back to those skilled jobs than women ever are. So there's a question of, like, what does this mean for their labor market returns, and the types of jobs they're able to provide. Like, one thing I should note is that you sort of see sort of more women in unemployment. And what's quite interesting is that this persists even conditional on migration, right? So what I'm showing you here is just, for women on the left, men on the right, in village or outside village, the share of women who are unemployed, that's the red bar, agricultural is yellow, gray is unskilled, and black is skilled. And regardless of whether or not they're in the village or outside the village, women are significantly more likely than men to be unemployed, right? So even for women, if they're able to get back to the city, there still seems to be some additional friction that prevents them from connecting back to jobs, and in particular, connecting back to skilled jobs. And what this means is that these re-migrants really struggle to regain their baseline income. Okay, so what I'm showing you here are kind of two graphs tracking earnings across the rounds. The one on the left is showing you earnings in rupees. The one on the right is showing you pre-lockdown earnings kind of as a share of, current earnings as a share of pre-lockdown income. And what you see, first I'm just kind of, these dashed lines are people that are unable to migrate, those that are remaining in the village. And you can see that nobody who remains in the village is able to earn, kind of significant income. And for both men and women alike, they're really earning less than 20% of what they were earning before the pandemic set in. Things look really different if we see what happens outside of villages. You can see one that for both women, who are the yellow lines, and men, who are the red lines, that those who are able to leave are earning significantly more. But the gender gap is enormous, and in fact much larger than the gender gap among those who are remaining in their home villages, in part because earnings in the villages are just so very low. And one of the things, I think this is probably, for me, one of the most striking findings in the paper, is if you look at that right-hand panel, right before the Delta wave, the male re-migrants had effectively recovered 100% of their income that they were earning prior to the pandemic, whereas kind of women who were able to get back to the cities, they're earning closer to 60-65% of what they were able to earn. So women just really struggle to get back to that initial state. Okay, I thought I had a speculative slide in this version that I wanted. I think I have time and I want to, okay, it's deleted. I don't know how that happened. I'm just going to speak a little extemporaneously, and I think there's a question of why that is. And so one of the things that we do that I thought I wouldn't have time to talk about today was to look at, one, just the share of those who are unemployed that are searching for work. Because, one story is kind of okay, these women came back to the village, they had all these responsibilities, they're just dropping out of the labor market. And it is true that there's about a 10 percentage point gap in terms of the share of unemployed who are looking for work for both men and women. But around 80% of women who are not working say that they're searching for work. So it's again, these women are intrepid, they're not giving up, they're just having a really hard time getting reconnected to those jobs. And if you look at the stated reasons for unemployment, you do see kind of the typical gendered things in which women are reporting, kind of greater household responsibility, kind of in marriage, whereas for men, they are sort of reporting, oh, I'm kind of concerned about COVID. And so, my overall takeaway is there's sort of a mix here, is that, women were kind of possibly doing less formal, less skilled jobs, and it may be that reconnecting to a worker, I think the problem of reconnecting to a factory is, perhaps an easier problem to solve than reconnecting to an individual employer, right? So it may be that the nature of the jobs that these two groups are doing in the cities have sort of made reintegration differentially harder for women. And I think there is also additional evidence that on top of that, there are kind of all these caregiving responsibilities related to childcare, pregnancy, so on and so forth, that really make search difficult. So with that said, I will now kind of summarize, what we see is that these displaced migrants experience lasting labor market shocks following the lockdown, right? We sort of track people for over a year, and both men and women, and particularly women, are struggling to catch up. Remigration is absolutely essential for regaining lost women. Those left in the village are just left at a much lower rate of earnings than those who are able to leave. Women are suffering higher rates of unemployment, lower earnings even when remigrating. And if you kind of put all of that together and think, like, what should we be doing about this from a policy perspective? My take is that this really points to a need for a sustained social protection response, which in many ways is a particularly important and pressing policy challenge, because we know in India, like, a lot of benefits are kind of tied to where you are, and migrants are really hard to reach anyway. And so there's sort of this double vulnerability that's going on, and that they've taken especially big income losses. Existing social protection schemes may not be particularly well equipped to serve them. And on top of it, these losses are not just transitory, they are persistent and large. And so I think this is something that I don't have answer to, but I do think it is kind of an urgent priority. And I'll maybe leave it at that, because I know that I'm standing between you and a very distinguished speaker who you may be more excited to hear about from me. So I'm going to cede the floor to our research lead, Urmi Bhattacharya, to do a proper introduction.
Thank you, Simone. I would now like to introduce our distinguished speaker for the evening, Shri Nagendranath Sinha, who is the Secretary of Ministry of Rural Development, Government of India. He will provide a policy perspective and his reflections on the topic. In his current role, Mr. Sinha is responsible for formulating, coordinating, and implementing programs to address development needs of the rural areas, especially focusing on mitigating and eradicating poverty and creating sustainable employment and livelihood opportunities. He has been a champion of women through his commitment to policies to engage and empower women. He has worn many distinguished hats in his illustrious career. These range from Secretary, Border Management, Ministry of Home Affairs, Chairman, Managing Director, National Highways and Infrastructure Development Corporation Limited, Additional Chief Secretary, Rural Development Government of Jharkhand, to name a few. He has, to his credit, several landmark projects in Jharkhand, including Mega Sports Complex and Games Village at Ranchi, Ranchi Ring Road State Data Center. But personally, to us at Inclusion Economics India Center, he has been an invaluable partner in our vision to ensure economic justice, social opportunity, and environmental protection through research and dialogue. Mr. Sinha, welcome.
Good evening to the distinguished panelists and distinguished members in the House. Today's discussion is a very important discussion and focusing on what are those factors which affect vulnerability, which offered solace and which offered opportunities for people to address some of those vulnerabilities. Obviously, an event like lockdown and pandemic, these are one in a century event, and they disrupt communities like anything, and we still now its reverberations continue to haunt us, and people are still being affected by COVID, and this is having impact, and of course being multiplied by events which are happening internationally, with which we are all familiar with. What I'm going to concentrate in during this evening is the issue of how these vulnerabilities have been to some extent addressed and mitigated by the large women networks that are there within the National Rural Livelihood Mission. So let's first talk about the kind of networks that has been created under the mission. And that is not to say that the networks do not extend beyond the mission in the rural areas. So at this moment, if you see the numbers in terms of the women who are part of the SHG network at this moment are over about 83 million or 84 million. Number of SHGs, if you see, these are about 76 lakhs or 7.6 millions. Number of village organizations are something like 440,000. So these are spread in about that many villages or cluster villages. And cluster level federations, which are there, which are for about 20 to 30 odd villages. So these are about 34,000 in number. So extremely large numbers. The National Rural Livelihood Mission programs forms institutions of the poor, empowers them, builds their capacity, invests them with funds like the revolving fund, the community investment fund, the vulnerability reduction fund, and food fund, and several other devices and assistance through which the communities work together to address needs for their empowerment, the financial inclusion, and the livelihoods. You will be very happy to know that despite the fact that the lockdown effect came on all of us, be it the rural areas or the urban areas, and despite the fact that a very large number of people, approximately about 10 millions, migrated to the rural areas, and the fact remained two areas remained important, and I think we all have to recognize, and the last presenter also adverted to the fact. One was that the agriculture remained robust, and the employment in agriculture didn't suffer. In fact, as compared to the previous year or even the year subsequent to it, the agriculture performance was something like 3 to 3.5%. It grew, and then the procurements were also robust. The other point to note was the fact that the Mahatma Gandhi Narega program also came in very handy. To give you some idea of how this performed vis-a-vis the earlier years, about 260 odd million or maybe 260 odd crores of person days were created in 2019-20, and this number rose up to about 390 crore person days during the year 2021. So the program adjusted in a very significant manner to address to the needs. So these two were if one may say, the macro factors which kind of helped the rural communities cope up with the additional stresses that came on them to a large extent. But in terms of the community's own response to it, the NRLM program responded and the women groups responded to it very beautifully. To give you, I'd like to give some areas in which the program in fact worked very well. The women, as you would be aware, that at the point in time when the lockdowns were imposed, there was a severe shortage of the masks in the country, and all these were at that point in time were being imported. Subsequently, the country developed significant capacities in production of masks and the personal protective equipment, but at that time it was not. And the women themselves volunteered, in fact provided employment to many, and about 23 crore masks were made by the women. About 600,000 liters of sanitizers and hand wash were made by them. Similarly, about 3.5 million pieces of protective gear were also made by them. So, extremely large number of personal protective equipment, masks, sanitizers, and other sanitary devices were prepared by them. The other area in which the women rose up to the challenge was the issue of running community managed kitchens. So, about 10,336 community managed kitchen came up, and they served around 57 million meals during the pandemic. So, again, extremely large number. The women networks were an excellent source of communication of the risks that attended the COVID, the responses that the community should have, the way in which they could handle with it, and the source for communication and other such needs of the community were beautifully taken to the members of the community. The fact that these are affinity-based groups and almost entirely cover the rural areas, particularly the vulnerable members of the community, it helped. To give you some idea of the numbers, at this moment, if you see the poor, as we learn out of the socio-economic caste census, these are about 9 crore, about 90 millions in number. And if you also include the people who are poor and may have been left out by the socio-economic caste census, so we take it as about 10% of it. So it's about 100 million families. Out of them, at this moment, as I mentioned, about 84 million women have been brought in this game, and at that point in time, it was about 70 million women were there. So the networks extended almost in the all the habitations, and most of the poor women were part of the network, and the NRLM program worked with the community to take the health messages to all of them, and about 500,000 community resource persons, and again they are a huge source of strength to the rural communities. They were all oriented, and the messages were taken to about 54 million rural households who are part of the NRLM program. So again, that was a very significant piece of the strategy which helped communities to cope up with the disruptions of the COVID pandemic. The women also participated along with the Panchayati Raj institutions to set up the COVID response centers. They served food, they brought the families, they delivered rations to the vulnerable households. One of the areas in which the NRLM program also helped communities to cope up with it was the area of work done through the BC agent, business correspondent agent. So when the banks were closed, through about 11,000 BC Sakhis, almost 83.63 lakhs or 8.3 million transactions were conducted, and about 1,845 crores rupees were dispersed to the women through the EBC Sakhi. So that way their need for cash was served by them. Why I am mentioning all these facts and figures? The idea is to the point that I want to convey is that while the COVID hit us all in multiple ways, the communities through the networks and the institutions that have been developed under the NRLM program rose up creatively and significantly to address the challenges through the capacities and resources that they have, and in the learnings that they have had in this process have not only built their confidence but also their capacities to deal with the world. So many of the women who were part of the supply chain in delivering food and vegetables, etc. So now they are able to engage in the e-commerce chains for supply of vegetables and food grains, etc. They have also become more organized, and this gave us and gives us confidence that the networks of this kind are in fact essential for addressing and responding to the disasters and the vulnerabilities that the communities face. So let's talk about some of the key characteristics of the response. So women took leadership in the response to it. So they surveyed vulnerable households. They ensured doorstep delivery of foods and supplies for the most marginalized. They provided catering services to the public hospitals and quarantine camps. They assisted in distributing benefits of the government programs such as food rations and managing rush and ensuring social distancing of customers in the banks. So they were able to adapt their existing skills and repurpose their livelihoods to fill gaps in the market for essential commodities and services related to food, sanitation, health, etc. They were able to focus on vulnerabilities and repurposed and adapted the resources that they had, such as Vulnerability Reduction Fund, Innovation Fund, Food Security Fund, Health Risk Mitigation Fund. And obviously they took support from the communities, panchayats, and then built upon them and served the most vulnerable, most marginalized among them. They also had differentiated strategies to address to specific vulnerabilities of the heterogeneous group, in the sense that if there are people who are immobile and can't move out to the COVID center, foods were served to them, medicines were brought to them, their COVID care were taken care of them, and the SHG members worked as part of the community response team to deliver these services. And one of the heartening things of this response was also the fact that the women adapted to the digital tools very significantly. There was not much, not a better way of communicating to women. In fact, no alternatives to other than communicating through the digital means. And in fact, the orientation of the communities as well as the community resource persons was through the digital tools like video conferencing, WhatsApp messages, Facebook, and such other social media. So the women were able to adapt to the digital media and use of digital media for not only for information and awareness, but also for conducting many of their activities, despite their lack of previous exposure to it. And this is a wider lesson, but the fact also remains that we do not give as much importance to the fact that the women could adapt to the digital media so well in such a short time, and this kind of an impression and the myth that many of us had was in fact destroyed, and I think that's a very positive sign. The Ministry of Rural Development has been one of the spearheads in the action as far as the COVID response was concerned, and I have already outlined two areas. One, the area of the Mahatma Gandhi Narega, and second, how the NRLM responded to the COVID. The third area was the Garib Kalyan Rozgar Abhiyan, which focused on 116 districts which had received the maximum number of migrants during that period, and the programs of about 12 ministries, if I remember correctly, were brought together to create about 40 crore jobs, about 50 crores jobs, and about 39 at an expenditure of about 39,000 crores of rupees. So this was another area, another response that this ministry had, and as part of the Pradhan Mantri Garib Kalyan Yojana was a disbursement of about 31,000 crores of rupees to the over 20 crore women Jan Dhan Yojana account holders. So that was at the rate of about 1,500 rupees per account holder. So a very significant amount and money was disbursed to a large number of people, and that was possible through the JAM kind of a network that the government had already created. And the last point which I would like to mention is that in addition to the social assistance grants that are provided to the by way of pensions to both old age person, the widows, as well as the disabled. So additional 1,000 rupees were provided to about 2.8 crore such persons. So about 2,800 crores of rupees were transferred to all of them. So we worked together with multiple ministries, and to the best possible extent, the vulnerabilities faced by the rural communities were addressed. However, one also realizes the fact that the disruptions of such kinds leave multiple vulnerabilities, impact people in myriad kind of ways, and any response, however comprehensive it could be, it would not be able to address many of the areas, particularly those relating to the mental health, etc. And so there are always opportunities of learning, and maybe these learnings through the channels like this help the government and public systems to improve their responses in future. So thank you very much for providing me this opportunity.
Thank you, Mr. Sinha, for your thoughtful remarks. We have a very exciting panel, and I'm sure you all have noticed a very exciting addition on the stage. But before we get to that, I would request Vinay if he could give a token of our appreciation to Mr. Sinha. Thank you. So I now hand over the stage to Yamini Atmavilas to moderate the panel and introduce one of the speakers, because everybody else has been introduced. But to introduce Yamini herself, she's a leader in gender philanthropy with a track record of building impactful partnerships in the philanthropic, private, and social sectors for advancing gender justice, including close to 10 years in Bill and Melinda Gates Foundation. She is currently in Circle In, where she leads the strategy and research for gender equality and women's empowerment. So with that, over to you, Yamini, but just wanted to remind the audience that after the panel, we'll take a couple of questions, but just to kind of manage it, I'll be sitting right here. So if you have a question you want me to hand over to Yamini, if you can just write it legibly in a piece of paper and just find me right here, that would be great. Over to you, Yamini.
Any change? Okay. Okay. Great. Thank you so much. And I forgot you sent us so many COVID protocols. Am I allowed to take off my mask? Okay, good. Thanks for that introduction. And thank you, everyone, for staying engaged. This is clearly a tribute to how fantastic this panel has been, and all the presentations and all the research providing so much rich insight at a time when, you know, there's so much heartbreak, anguish, and I think the recovery, we've all been talking about post-COVID, where I think it's more aspirational, and I hope that it's not just aspirational, but certainly giving us reason to, you know, focus on what is it that survival looks like, what does coping look like, what do women's solidarity networks look like, and that, you know, I think we've heard so many different dimensions of this. But before I launch into the panel, let me take a moment to introduce the one who needs no introduction, but I'm still going to take a shot at giving a very quick welcome to Barkha Dutt. Thank you so much for joining, Barkha. No introduction needed, but an award-winning journalist, certainly. Her latest book, To Hell and Back, Humans of COVID, her personal story of loss, and her determination to continue telling the story of COVID and communities and coping has, you know, I think touched all of us, and no one is left untouched with that. Also founder, editor of Mojo Story, a multimedia digital platform, author of also this Unquiet Land, Stories from India's Fault Line. So welcome, Barkha, and thank you so much for joining. So maybe a round of quick sort of. All right. So I had lots of questions I wrote down during the panel itself, but I'm going to just start off. Maybe, you know, I think there's lots of multiple points, and just a quick recap maybe for Barkha's benefit also, that, you know, each of the research pieces and then they're all together as a set sort of painted this very broad canvas of how, I mean, the last presentation you heard, which was, you know, how women's groups and women's networks became this very, very strong system of solidarity, resilience, coping, financial sort of solidarity, as well as taking up the opportunity of building enterprises and, you know, kicking off enterprise growth by being sort of resourceful and sort of responding to a market, you know, whether it's masks or hand sanitizers, et cetera, et cetera. In addition, we heard about the NREGS program, the largest social protection program in the world. Again, not just being a safety net program, but also actually building aspiration and building sort of confidence in women that there is market demand for their work, and that work is meaningful, dignified, and much needed at this, especially during this time. We also heard about digital use and access sort of becoming, I mean, we've heard so much about how important it's been, but I think
to see rural women, I mean, especially because we operate with so many strong stereotypes and not unfounded, that norms really prevent women from fully using digital, but to sort of see how all of that starts to shift, right? And I think with that, maybe my first question is to sort of ask Rohini, you know, you and Vinay spoke about large economic changes, shocks, catastrophes, sort of bringing both, you know, stories of bringing both anguish as well as change. And I was curious to sort of just lift us back up and sort of talk about how, you know, how the relationship between those kinds of big changes, and this has certainly been one of the biggest for us in our lives, and gender norms and gender relations, arrangement, markets, like how do women start to sort of look different? How do men and women sort of behave differently? How does power shift? Does it shift enough? And so I don't know if you could give us a little bit of a lift up framing to get us off.
Sure, thanks. I'll be swift because I know it seems to be working, hopefully. Can you hear me? Yeah, great. I'm actually just going to use one example to remind us of how sometimes change doesn't happen, which comes really from the start of computing. So, as many of you know, kind of the period of World War II was around the time also when coding and computing started, and there's very famous stories of the crypt breakers in the UK, in Bletchley Park, which were all women. And this was a time when just after World War II, British women had a strong advantage in the computing sector. They were the coders. They were the ones who had discovered it. And yet, over the next 2 decades, we saw them completely fall out of the sector. And you also saw this was a sector where actually women were the majority in the fields of computing in terms of entering just the college degrees required, and that completely changed. So much so that now we are at a point where, you know, Google engineers will talk about how women just don't make good coders. So I think, you know, big moments are moments where certainly women enter. I think Sinhaji spoke very eloquently about the many ways in which women have been holding up the rural economy. But the question really is, right now we are probably coming back to a point of tight labor markets. And as Simone pointed out, you know, there are going to be not just opportunities in the rural sector, but there'll be opportunities opening up again in the urban sector. And there's really a question of whether women will just get pushed out a little bit, or whether we'll be able to harness this change. And I think that's really the big question that I think is there, is, you know, which way is it going to go? Women have got a foothold. I think Bhavya spoke as well about how we saw them in different ways play a really important role as government workers. But you can completely imagine, you know, India is going to add 22% of the global labor force in the next 30 years. You know, this is a huge number of people who are going to be entering the labor force. You know, is this going to be an opportunity to women, or is it just going to be, you know, they'll get partitioned into small gig economy jobs, and we will just, you know, see this moment pass?
Thanks, Rohini. Maybe I'll pick up a thread from there and maybe ask Farzana. You know, you spoke about social protection as well as government sort of creating work, creating jobs, creating opportunities, and absorbing women into as paid workers on different programs. And Farzana, you sort of hinted to this, that the urban job guarantee program is potentially a strong safety net, a strong sort of driver that one needs to sort of pull women back. The losses of jobs in urban for urban women is extremely staggering. So wondering if you want to reflect a little bit on that. I know we know that states like Rajasthan, Odisha, Tamil Nadu have started to build, implement urban job guarantee programs, but I think the gender ratios, the gender mixes are TBD still. So any quick sort of thoughts on that?
Yeah, so just referring to the work that we did when we looked at Narega in rural areas, was the fact that it provided a huge amount of support to rural families, particularly women who were able to take advantage of those jobs The two things that stand out, one is the fact that women, given these norms, prefer work which is closer to home because they have restricted mobility. And the second is the fact, again, I think which was also pointed out by many of us on the panel, is the fact that women prefer government jobs because of the respectability. But these preferences are internalized, of course, you know, because the families also have that kind of work preference for women. So the providing social protection in an urban context becomes increasingly important given the fact that we see low levels of labor force participation in urban areas. It's lower than historically than in rural areas, and the fact that we need that buffer given the shocks that have been experienced in urban areas, which to some extent have been larger during COVID than in rural areas, and the counter-cyclicality that we see in women's labor force participation. Many of these women want to work. Women definitely want to work. They do not have enough opportunities, and we need to create opportunities for women to work. And I think the first provider here would be the government in terms of responding to that, and the private sector hopefully will follow thereafter.
Thanks, Farzana. I'm going to now pivot to Barkha for multiple reasons. You know, you've also, prior to the pandemic, had these large convenings through your platform, sort of raising this question of women's empowerment, women's employment, and really doing a bit of a, actually city-specific, region-specific conversations, inviting local players, local partners to really come together to see what's happening, understand where the gaps are and what the opportunities might be. And of course, I mean, your COVID coverage has been, not just the episodic one, but that continuous, keeping that in our focus has been great. So it's hard to come up with one question for you, Barkha, but I'm going to try and sort of give you a very high meta question and let you answer as you'd like to answer this, which is, what gives you hope? Where are things headed? What is, I mean, the despair is there, but clearly there are, we've heard about points of light that are emerging through some of these stories and research of evidence. So what gives you hope? What is it that you're sort of hearing, given you're so close, your ears so close to the ground?
Thanks, Yamini. I think two things. I mean, one, of course, the disclaimer is that I am not a policy person, so everything I say is impressionistic, is anecdotal, is based not on hard numbers and analysis, but just people I've met, women I've met, young girls I've met, and so on. And I think there is sort of twin reasons for hope at a time when it doesn't look like this context to be much sort of hopeful. One, of course, is, I think we heard from Mr. Sinha and other speakers, that safety nets do work. They do work if they can be accessed. So one of the things that I found was that a lot of times there wasn't enough awareness of how to respond or access a safety net. So even when, for example, there were announcements of the fact that women would be given X amount of cash every month, I would meet women who kind of knew about it, but knew about it in a kind of vague way and did not know how to convert that into a kind of specific mechanism of access. Narega, by contrast, is something very well understood, and I think there's a kind of deep understanding of how to access that kind of daily work or daily wage. I think a lot of other benefits, while they exist, are not as well known. I think the dissemination for that needs to be much deeper. But talking about hope, I think the biggest hope, apart from the fact that many of these policies have been thoughtfully crafted and just need to be disseminated more widely, actually comes from the women and girls that I met. It comes from their desire to return to the workforce. It comes from their desire to find and build an alternative future for themselves. So let me just share one example that I think is at the intersection of so many things, of economics, of societal attitudes, of digital divide, but also of hope. I traveled to a village in Rajasthan, and as many of you know, India has made significant improvement in containing the number of child marriages. But one of the very disturbing things that returned during the pandemic is that because of the sort of depression and economic activity, families started returning to pressuring underage girls and pushing them into marriages. There were a couple of reasons for this. One was that they thought it would be cheaper. Everything was shut. They were not expected to host these sort of lavish sort of ceremonies. The other, and that was a little more depressing, is when you had 7 or 8 people of a family pushed into a confined space, let's say in a lockdown, there was a sense of the girl child not always being safe at home. We do know that the NCW records a spike in domestic abuse during this period, and we met mothers who actually thought that their little girls would be safer being pushed out and being sent to some other little child, boys' home, and so on. Now that seems depressing, but what happens next, and one more depressing fact before I come to the moment of hope. We spoke so much about digital mechanisms, Mrs. Sinha spoke about them, and it's true. There was a lot of, you saw that digital capacity, but once again you come back to the fact that women and girls weren't often able to access that. So I was, I saw with my own eyes that if there was one digital device in a home and there was a boy and a girl, then the girl would not get to attend the digital classroom and the boy would, and so on. So this is, I think we look a lot towards government and government policy, but we don't look enough towards society. We don't look enough towards how power is organized in our homes. And I think that is where policies are often inadequate, no matter how well-intentioned they are. Because either they can't be accessed, and if they're available, you won't have people willing to access them. There will be, for example, suspicion even today of women owning smartphones or being able to access the internet and so on. But what gave me hope was that young women in this village then decided, because they were constantly asked, what are you doing? You're a burden on the family, you're not going to bring home money, you're not going to school, what are you doing? And they decided to organize themselves into a football team. And they decided in the height of the pandemic to start playing football. And these were women, most of them, young girls rather, who wanted to become bureaucrats and police officers. Almost routinely, like if you asked a girl in the village, a 17-year-old, what do you want to do, a 16-year-old, what do you want to do, they all wanted to join government. They all wanted to join government. But because they were not able to stave off the pressure, because otherwise they were being told, go get married. And they had to answer, what do you do all day? So with the help again of a women's group, so that returns again to something that works, there was a women's sort of grassroots organization that deployed a coach in the middle of this pandemic, who would then come from the city of Ajmer to this village and teach these girls how to play football, and then the mothers finally started quietly nudging them and managing the pressure from the men and the village elders at home. So I think this is the kind of thing that reminds you that there are dreams, there are aspirations, there are also policies, but then there is this long gap. Policy is well-intentioned, but there's either a lack of awareness or there's such a sort of deep-seated social conditioning that those dreams are, and so who is going to cover, what is the mechanism we're going to find to connect the dream to the policy? I mean, if I had to identify a weak link, it is that. Where those networks work, where that policy can be accessed, there is cushioning, right? And I think we've been speaking so much about women and the labor force. And again, government can announce 10 policies, but what are you going to do with the fact of the absence of equality at home, where the male partner is not going to participate in help with housework, homework, looking after children? I think it's well documented that so many women left the workforce, especially in urban areas, because they just couldn't handle the pressure. And finally, I think one of the slides spoke about why it is that, the nature, is it the nature of employment that many of these migrant workers, when they are female, have, especially in urban pockets? It was my impression that it is very much the nature of employment, because again, a lot of women, again going back to because they need to be closer to home and they need to go back home and they need to be there for their children or their in-laws or their parents, were mostly working in these kind of part-time, it wasn't full-time employment, it was X number of hours, mostly like, let's say in somebody's home, as help, as cleaners, and that kind of role. And of course, between fear, paranoia, lack of information. A number of women were locked out of the kind of high-rise apartments that so many of us live in. But mostly they again felt that pressure because they had to look after the home and they had to look after work. And I think that we can keep asking our governments to frame better policy. But I think the real gap is in the fact that that policy exists, but it isn't utilized. And there's either a lack of awareness or a lack of acceptance of that policy. So the hope comes from very much the desire all the way from young girls to old women. We haven't spoken about the vulnerability of old women who were abandoned, left, thrown out of their homes, who were much too old to be able to use technology, who didn't know where to turn. But the hope comes from the fact that from the 17 to the 70-year-old women I met, each one of them wanted to be self-reliant. Each one wanted a space of self-reliance. The hope comes from the fact that where there was access to safety nets, there was cushioning. The anxiety comes from the fact that policy by itself is not sufficient to bridge this. The real divide is societal. And I don't know that, the existence of safety nets is going to change that. Yeah, so I'll leave it there for.
Great. So many more questions that come. But thank you so much, Barka. Maybe because we didn't benefit from you for a while now. I have a follow-up question, and it's a bit of coming from left field. I didn't get it. They discuss it with Charity. But since we have you here, and obviously there's excellent research, deep research that this team, this group here on stage have carried out. And your stories are equally compelling, equally rich, equally fact-based. So I think that divide between research and media stories, media coverage, this kind of, it's almost like ethnography, that you are doing. I guess my question is still formulating in my head, but it feels like that we need to break that kind of distinction. Wondering if you have a reflection on that. Maybe it's a question of how can research better work with media, how can, so maybe there's a set of questions there on that. But I'll let you run.
I think that's a great question, right? Because if you try and talk about female labor force participation to a general audience, they will look at you in a blank way and they will not understand what it means. And if you say fewer Indian women are working today than 10 years ago, their eyeballs will pop out of their sockets because they don't know that. Because what they're actually seeing are headline stories, and those headline stories are also accurate about women now being allowed into the NDA, and women leading boardrooms, and more women managing newsrooms, and women sarpanches, and there are genuine shifts and success stories. But what is happening is that then becomes the narrative that our world has shifted, our lives have shifted, policies are forward-looking. We've got an excellent judgment from the Supreme Court right now on reminding, it's sharp contrast to the United States of America, on restoring reproductive autonomy to a single woman, unmarried, allowing her to have an abortion at 24 weeks. So there's much to be proud of in terms of accomplishments, but people don't understand research. They don't understand data. They don't understand the language that is used in research. They don't even understand labor force participation. If you try to create awareness on the back of this kind of legalese or this, and not to take away from, we need this research to understand, we meet individuals. For us to see whether there's a pattern, a generality, a larger truth, we need this data. But I think there has to be some way for us to be more data-oriented, scientific, and for people in academia to be more about human beings and less about numbers. And I think in that, again, there's a gap that needs to be bridged there. So.
I think we could spend a couple of hours on this. But thanks for sort of provoking us and making us sit up. I don't know if the researchers have any quick...
I'm sure there needed to be about it. I'm saying not people, you can't access it like that.
Completely, yeah. Rohini, you're in the hot seat, so go for it.
Yeah, so I've known Barkha for a long time, and she did English in college when I was doing economics. So this is also a debate that has been going on a very long time. But I completely agree with bringing sort of people to the center. I think that's something that, in fact, I'd say in how we often not just communicate, but also how we teach economics. We lose, I think, a lot of the next generation of social science researchers in India because, they think about it in terms of almost like national income accounts. They don't think of it in terms of people. And I think, just to give a plug at this point for the Inclusion Economics India Center, I think a big aim for it is actually to try to think about not just this, how to communicate, but also to try to think about how to persuade, young people entering college or staying on in college that actually, thinking about doing good in the world is also about doing social science research. And I would say that in that sense, economics has a bad name across the world. I mean, I think in lots of places right now people think if you want to think about issues of social justice, don't go to economics, go to disciplines other than that. And I think there is a lot of value in trying to change that, not just for journalists, but even more broadly.
Thanks, Rohini. I'm going to now just share a question from the audience. It's specifically to Charity, but anyone can jump in if they feel strongly about it. I think the question is, I'll just summarize it, but basically you sort of talk about ASHA workers, Anganwadi workers, that workforce as an opportunity, and government-created sort of part-time work as an opportunity for women to access incomes. And I think the question is really, these workers are underpaid, undervalued, and not always getting insurance. So it's not, I guess, decent always in some ways, like that, especially some of these part-time sort of opportunities. Any quick response on any sort of reflection? I guess, hard to disagree, but then what's the next?
Yeah, no, I completely agree. I think one thing that we've noticed just kind of in interacting with women as government workers is in some ways it feels like they're treated as kind of second-class workers, right? And so I think to really take advantage of this opportunity, it's really important that these jobs are not viewed as add-ons. They're not viewed as something that you just receive an incentive for. It's a payment for work that you do. It's not an incentive because you're, altruistic and you want to be doing good in your community. That might be true, but that doesn't mean that you shouldn't receive a regular wage, or your wage doesn't need to arrive on time, or you don't need additional training or whatever it might be. So I think the more that we can do to professionalize the types of work that are being offered by government to women workers, the better, definitely.
Thank you. Another question just across a couple of different presentations. So I think this question of social networks and technology. So one of the presentations was about social networks, and I think Mr. Sinha laid out this really, rich sort of tapestry of what all NRLM women's groups are able to accomplish, both as institutions as well as networks of women, and where the opportunities are. And then the Chhattisgarh work was about technology, about women accessing that technology, and in the kinds of, especially pandemic challenges of lack of, additional sort of layer of mobility restrictions, that technology kind of becomes a specific type of technology, digital technology becomes a pathway to accessing the wider world. And I think that, so I just wanted to see if one of you wanted to take this question of, what's the plus of that? Like if you have your women's networks and then you have digital networks that are, digital capabilities that then allow women to access things beyond that geographical restriction. Any sort of future thinking on that? Anything that you want to sort of see if you have the secretary of the largest women's group program in the world here? So,
one of the large advantages that, as a little bit of a preview on the paper that we're writing now, is actually that access to digital technology seems to also improve women's opportunities for work. The work tends to be agricultural, as that happens to be the work that is available in rural areas. And so in as far as creating access to these digital technologies and generating easy ways for women to access the markets in which the work is available. I think that's, it deals with the mobility issues of having to go out and find work yourself. It's work that you can access digitally, at least to find out about it. There are initiatives thinking also about whether there are ways to integrate women in working in the digital space. So having, I have a colleague at Microsoft Research who has done a lot of work in basically trying to find apps that generate employment for low literacy women. And so, as far as we are giving women access to the internet and the world, that might be expanding opportunities locally, but also potentially globally, and in ways that don't bind them because of mobility restrictions.
I think we're like a minute, so last word, anyone? And if you're going to have a last word, I'm going to add like a part B to that, which is about digital literacy, right? I think the barrier is not just access, but then how do you get functionally, how do you use it? So I don't know if you want to add like 30 minutes on just 30 seconds, 30 seconds on just quickly telling us, and then everyone can then come and talk to you over dinner, but give us like the little bait that will make us
related to digital literacy?
Yeah.
Yeah, no, I think that we've found in Chhattisgarh that phones are important, but also training is important too. And even, a short group-based training that we've looked at appears, at least preliminarily, to be a pretty effective, important component of women's onboarding into the digital space. I'll say one last thought since I have the mic. Urban safety net. We saw rural safety net shapes norms around women in work. I mean, maybe an urban safety net can be very important and instrumental for that too when mobility is so curtailed. So, yeah.
Yeah, well, unfortunately, out of time. I've been ignoring this young lady, like flashing those numbers at me. So, yes.
Just have another meeting.
Okay, well, thank you so much, Barkha. Bye. And with that, I'll hand it off to Barkha, just 30 seconds. I think there's a little, gift for you.
Thank you, Yamini. Always thought-provoking questions. Well, this ends our policy dialogue today, but before you get up from your seats, just a couple of things. Thank you so much for participating. I know that it has been really inspiring that every one of you sat through all these engaging presentations, but also kind of engaged with the data and the insights shared. And hopefully it's the start to many more in the future. But before we head for dinner, just would request Vinay to present small tokens to our speakers. But Rohini and Charity, sorry, I think we just think of you as I don't know, later, we'll do this later, so yeah. And then if you can all, after this, it would be great if you can all join us for dinner outside. Thank you. Yeah, that's very weird. All right, thank you everyone, and so yeah, let's eat. Thank you.
Well done.
I loved your presentation style.